my name is Brittany. I'm going to be performing a head-to-toe assessment. I'm going to be inspecting your body for any abnormalities, auscultating to listen for any abnormalities, and palpating and applying light touch to find any sensation differences. I'll also be percussing to check for any fluid in your tissues.
Okay.
Is this okay with you?
Yes.
Okay. I've performed hand hygiene already. Can you tell me your name and date of birth?
My name is Amber.
Okay. And when's your birthday?
June 30th,
Okay. What year?
1975,
Okay. Can you tell me where you are?
in Bradenton,
Okay. And can you tell me what month it is?
April.
Great. And her speech is clear and appropriate. I'm going to be testing your coordination and fine motor skills. Can you put both hands on your knees for me? And can you touch your thumb to your other thumb? Good. Now I'm going to be testing the accuracy of your movements. So I want you to touch your finger to my finger. Now touch your nose. Now touch my finger. Now touch your nose. And same with the other hand. Touch my finger, your nose, my finger, your nose. Good. No ataxia noted. We're going to, now can you touch your heel to the top of your knee right here and slide your heel down your shin and back up. Good. Good. Okay. No ataxia noted. And same thing with the other leg. And again, no ataxia noted. Perfect. So next we're going to be checking your balance. So I'm going to be testing your balance utilizing the Romberg test. I'm going to have you stand with your feet together. Go ahead. And look straight ahead. Oops. And hands to your side. And we're going to be watching for any excessive swaying. None noted. Now I'm going to have you close your eyes. And same thing, we're looking for any swaying or loss of balance. None noted. Okay. All right, go ahead and have a seat. Next, I'm going to be testing your primary sensory function. So I'm going to prick your thumb web with the tip of this object. So go ahead and hold your hand out like this. And can you open up your thumb for me? And can you feel this?
Yes.
Okay, and how about on this side? Let's test your other hand.
Yes.
Good, okay. Next I'm going to be testing your temperature sensation. Go ahead and close your eyes and tell me if this is hot or cold.
Cold. Cold.
Good, okay. Next I'll be testing your sensory function with an extinction test. So I'm going to have you close your eyes and I'm going to touch different parts of your body and I want you to tell me where I touched you.
My arm.
Which arm?
My right arm.
Good. Okay.
My right wrist.
All right.
My left arm. Left hand.
Good. Okay. Next I will be doing a graphesthesia test. So I'm going to have you close your eyes again and I'm going to trace letters and or numbers on your palm and I want you to identify what number or letter I traced. Okay?
3.
Good.
2.
Good. Okay. And over here.
2. 0.
Good. Okay. Next, we're going to be testing your reflexes. So we're going to be testing your plantar reflex. So I'm going to have you hold up your foot for me, and we're going to drive an object down your foot, and we're looking for that reflex. Exactly. That's when we're looking for. Okay. And then same thing with this leg. Good. All right. Perfect. Okay. So next I'm going to have you close, we're doing a Snellen test. It's a visual acuity test. So go ahead and put a hand over your left eye. We have a Snellen chart on the wall. Go ahead and read as many lines down as you can, starting at the top.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Perfect, good. Okay, and go ahead and with the opposite eye. And again.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, EDFCZP,
Perfect.
FE.
Good. All right. Okay. Next, we're going to be testing your visual peripheral fields using a confrontation test. I'm going to place my hands behind your head. I'm going to start moving them closer together. I want you to tell me when you can see my hands, okay? So go ahead and look directly forward.
Yes.
Good. Okay. Next, I'm going to shine a light in your eye, and I'm going to be looking at your pupils. So go ahead and look straight ahead. Good. Good. Pupils are equal, round, reactive to light, and accommodating. So I'm going to be holding a scope in your eye. An ophthalmic scope. I'm going to examine your pupils. Good, okay. And the lens is transparent with a tinge of yellow. Blood vessels showed no evidence of hemorrhage and were visible in all 4 quadrants. No areas of pigmentation were noted when viewing the fundus. I also checked for corneal light reflex when I did this. The light reflected symmetrically in both eyes, and there was no imbalance noted. Next, we're going to be using an otoscope to look inside your ears. First, noting the external shape is symmetrical. The ears are normal in size, and the shape of the ear is normal. The color of the ear is consistent with that of this color of the skin on the patient's face. Next, we're going to be examining the external meatus, and there is no discharge noted, no foreign bodies, no redness, edema, tenderness. So next, we're going to be pulling up the ear and examining the inside of the ear. Good. Okay. So when I did this, there was no perforations, no tenderness, edema, inflammation, or drainage noted. Okay. Next, we're doing the whisper test. I'm going to whisper something in your ear, and I want you to tell me what I said. Okay?
Baseball.
Good. Okay.
Table.
Good. Okay. Next, we're doing the Weber test. I'm going to set the tuning fork in vibration and place the base of the fork in the midline of your forehead, and tell me if the sound is heard equally in both ears or in just one ear.
Equally.
Good. Okay. Next, we're doing the run test. I'm going to set the tuning fork in vibration and place the base at your mastoid bone. Please specify when the sound is no longer heard, and then I'll place the tuning fork in front of your ear and tell me if you can hear the sound from the tuning fork. Okay, all right.
Okay.
Okay, okay. And then I want you to tell me if you can hear it better when I place it here or when I place it here.
There.
Okay. All right, and same on the other side. And we can't hear it anymore. I can't hear it. Okay, and tell me which you hear it better, here or here.
The same.
The same. Okay, perfect. Okay, next we're doing inspection and palpation of the mouth, nose, and throat. So smile and clench your teeth. Good. Let me see your teeth. Perfect. Okay. We're gonna go ahead and open your mouth for me. Good. All right. All teeth are present with no spacing, gums pink in color, no bleeding or inflammation noted. Good hygiene, no odor or plaque. The uvula and tonsils are present, no ulcers, masses, or inflammation noted. Now I'm going to inspect and palpate all of your lymph nodes, and while doing so, I'll also inspect your thyroid. So, starting up here, we're just looking for any enlargement, any nodules. Okay. Perfect. Okay. No nodules or enlargements noted. Let's move on to the chest and lungs. Chest shape is symmetrical. There is no spinal deformity or bulges noted. The costal angle is 90 degrees here. Do you have any tenderness anywhere in your chest?
No.
No? Okay. Her respiration rate is 16. It's regular, unlabored, and no cyanosis or nostril flaring noted. We're going to be locating anatomic landmarks such as the trachea, the suprasternal notch, the angle of Lewis right here, which is the cartilage of the second rib. We also noted the costal angle here, which is at 90 degrees. And we're noting C7 and T1 at the base of the spine. Now we're going to go ahead and auscultate or listen to your lungs. We're listening for adventitious breath sounds, such as crackles, rhonchi, or wheezing. So go ahead and breathe normally. Deep breath here. Go ahead and lean forward for me. Deep breath here. And here. Good. No adventitious breath sounds noted. We're going to do the bronchophony, which is when we have asked the patient to whisper 99 to rule out lung tissue solidifications. Go ahead and whisper 99.
99. 99.
Good. Okay. So we palpate the chest for tenderness or masses. So go ahead and take a deep breath. And I'm noting her chest for expansion and costal breathing noted. We're going to percuss intercostal space, not over the bone. Good. Okay. Now we're going to be palpating for tactile fremitus. We touch our fingers together, place on the outside surface of the hands, and repeat the phrase 99.
99.
And again.
99.
And
99.
again. Good. Tactile fremitus is increased by a fluid or a mass. Next, we're moving on to the heart. I'm going to be inspecting for an apical pulse. And we're going to test for any scars indicating cardiac surgeries. So we palpate first the point of maximum impulse at the apex. We're noting any thrills by placing a palm over the heart. Carotid arteries, go ahead and turn your neck side for me. Also looking at venous distension here, none noted. Okay. And this way. Okay. And this is where I would check the pulse for a full minute. Okay. When we percuss at the third and fourth intercostal space, the normal finding should be dull. Okay. Lower extremities, we're looking at Holman's sign for any sort of pain, redness, or swelling. So when we have flex your foot for me, does that hurt at all?
No.
Good. Okay, we'll check the other side, same way. Flex your foot for me. And any pain noted here?
No.
Perfect. Okay. We're going to also check for edema. We can check her capillary refill on her toes. Good. And we're to also check for a range of motion. Can you bend your leg for me and extend? Good. And flex and extend. Perfect. We would also check her pedal pulses bilaterally. Good, nice strong pulses there. Peripheral circulation, we're inspecting for peripheral edema. There's none noted. We palpated her pulses. We're also looking at the brachial and radial pulses. Good, and those are both present. We've checked both arms. We'll check popliteal pulse behind the knee. Good. And over here. Good. Nice strong pulse. Okay, major vessels, we're going to be inspecting for pulsation of the carotid arteries, which we did when we had her turn her head from side to side. We were looking at JVD, or jugular vein distension, and there was none noted. We palpate the carotid pulse, always one at a time, never at the same time. Good, nice strong pulse. Okay, and then we can auscultate the carotid arteries. And no bruit noted. Okay, next we're moving on to the abdomen. First, inspect the abdomen. We're looking for any abnormalities. We want to see a nice flat abdomen. Next, we would auscultate. For our purposes, we're obviously not going to have her lift up her shirt, so we'll move on to auscultation. And I auscultate all four: the left upper, left lower quadrant, right upper quadrant, right lower quadrant. The same for bowel sounds there, times 4, which there are. And we want to palpate the abdomen. It should be nice and soft. You don't want any round distension. And when was your last BM?
This morning.
Good. Always want to make sure that you ask when the last BM was. And next we're going to be palpating the radial pulse. And those are equal and strong times 2. Next we're checking your grip. Go ahead and squeeze my fingers. Good. Strong. And we check the capillary refill, which is less than 3 seconds. So lastly, we perform an Allen test. I'm going to have you go ahead and clench your fist, just one, for 30 seconds. And then using my fingers, I'm going to apply occlusive pressure to both ulnar and radial pulses. And then when she opens her fist, the area should be blanched, okay? And normal color should return within 7 seconds. Okay, go ahead and release your fist. And color comes back immediately. And that concludes our head to toe assessment.